So acid reflux and heartburn is a very common symptom that a lot of people suffer with. It has to be investigated properly, and that means that you have to come and see myself or your doctor, and I go through a consultation, find out obviously how severe the symptoms are, but also whether they respond to medical treatment. And then once that is established, then we can go through an investigative process with tests such as a camera, an OGD, and endoscopy to look at the lower end of the gullet and see if there's any defect there, if there's a hernia or inflammation or an ulcer perhaps related to acid burn of the lower end of the gullet. And then once that's established, then we can look at measuring how much acid comes up into the gullet over a 24, 48-hour period of time. That's called a pH manometry test, and really is very important for surgeons looking to rectify this problem with surgery. And surgery is generally a fundoplication operation that we look at. But this investigative pathway has to be followed so that we actually know whether or not acid reflux is a problem and whether it has an effect on the body before we can progress. So once we establish that reflux is an issue and the symptoms are quite classical and genuine, and that it responds to medical treatment, but people can't stay on the medication or they require an increasing dose of medication over a period of time, then of course, after having done the test, the pH manometry test, which measures how much acid comes up into the gullet, we can talk about surgery. And generally surgery is keyhole operation, general anesthetic. That's what a fundoplication is, and it's done by taking the floppy bit of the stomach and wrapping it around the lower end of the gullet to create a valve-like effect. And the valve is basically strengthening what we already have and trying to prevent the acid that's in the stomach from coming up into the gullet. And that's called a fundoplication operation. There's many types of them, but the most common type, I think, is the one where we do 360-degree wrap around the lower end of the gullet, and that's called a Nissen fundoplication. So with procedures generally that are keyhole procedures, there will be a process before the procedure where we pre-assess you, which basically means you come in, you have a test with a nurse, all the blood's done, perhaps maybe even an X-ray or an ECG, depending on whether we require one or not. It's very possible for you to also meet an anaesthetist, and then we're ready for surgery, and we book you in for the date of surgery. We don't expect you to have anything to eat or drink at least 6 hours before your operation. You come in on the day, we get you prepared. It's a general anesthetic, and obviously go in with camera and instruments, usually 5 small cuts in the upper part of the tummy. And what I do is, I first of all dissect the hiatus hernia. So if there's a hiatus hernia or part of the stomach has gone above the diaphragm into the chest, what I do is I dissect it out and bring that bit of stomach back to where it belongs inside the tummy cavity. Once that's done, I make the hole around the gullet snug by putting some sutures in, and then take the floppy bit of the stomach and wrap it behind the gullet in a 360-degree wrap, which recreates the valve at the lower end of the gullet and helps prevent or helps stop the acid that's in the stomach from flushing up into the gullet and causing these symptoms. Interestingly, fundoplication operations with keyhole surgery have become very, very safe. Many years ago, maybe about 30, 40 years ago, this particular operation was performed through open surgery, and the cut that was required to perform the surgery extended from the chest all the way down into the tummy cavity. So it was a big scar, it was going across the diaphragm, and it was quite a major, ultra major operation, which had a lot of risk and may well have been fraught with complications. At the moment, because of keyhole surgery and the advances that we've made, we can actually use cameras from the inside, go through the bottom, through the tummy, and not have to deal with the chest at all, or open the chest or go through the chest, and perform this operation usually within, I would say, 35 to 45 minutes for operative time, and it normally is quite a safe operation with minimal risk. And the normal risks of laparoscopic surgery are things like bleeding, infection, clots in lead veins, or conversion to an open cut. But that's quite common across all keyhole surgeries. So after people have had a fundoplication, what happens is the lower end of the gullet has become tighter because there's a valve that's been wrapped around it. And as a result, people will find that it's more difficult to eat large portions or to swallow big amounts of food at once, and perhaps things like steak and bread may stick above the wrap. And therefore, our recommendation is always eat little and often, chew food very well, make sure that you're leaving quite enough of time between mouthfuls to allow the food to go through. And generally, it just makes people go much slower with their food, eat slower, and have a lot more chewing time. But generally, that's the only requirement to change after surgery in terms of eating behaviors.